Hi, everyone. This is Nurse Anna from nursestudy.net. And in this series, we're going to be doing cardiogenic shock questions with answers and rationales. Before I forget, I do have free audiobooks via A6 Audible. All you need to do is look at the link in the description, and it's a free 30-day trial. You can get through the book within the 30 days. So please utilize this to get more questions for NCLEX NGN that you can listen to in your car or in the library.
Question 1. A patient with a history of myocardial infarction, MI, presents to the emergency department with hypotension, tachycardia, and cold, clammy skin. Which of the following interventions should the nurse anticipate in the treatment of cardiogenic shock? A. IV fluids bolus to rapidly expand blood volume. B. Administration of dopamine to improve myocardial contractility. C. Initiating high-flow oxygen and positioning the patient in the Trendelenburg position. D. Administering nitroglycerin to reduce myocardial workload. Answer: B. Administration of dopamine to improve myocardial contractility. Rationale: dopamine is commonly used in cardiogenic shock to increase contractility and cardiac output. IV fluids are administered cautiously in cardiogenic shock due to the risk of fluid overload. Oxygen is appropriate, but Trendelenburg positioning is not recommended in cardiogenic shock. Nitroglycerin may decrease myocardial workload but is used with caution due to hypotension. Question 2. A 65-year-old male presents with acute decompensated heart failure. The nurse notes an elevated pulmonary capillary wedge pressure, PCWP, and low cardiac output. What is the primary cause of this patient's cardiogenic shock? A. Increased systemic vascular resistance. B. Impaired left ventricular contractility. C. Fluid overload. D. Ventricular septal defect. Answer: B. Impaired left ventricular contractility. Rationale: cardiogenic shock in this context is typically caused by the failure of the left ventricle to pump blood efficiently, leading to reduced cardiac output and elevated PCWP. Fluid overload can exacerbate the condition but is not the primary cause. Increased systemic vascular resistance and a ventricular septal defect can also contribute but are less common in this presentation. Question 3. A patient is diagnosed with cardiogenic shock following a massive anterior wall MI. The healthcare provider orders norepinephrine. What is the nurse's priority before administering this medication? A. Assessing peripheral pulses. B. Ensuring the patient has an arterial line. C. Obtaining consent for the procedure. D. Checking the patient's oxygen saturation. Answer: B. Ensuring the patient has an arterial line. Rationale: norepinephrine is a potent vasopressor that requires continuous monitoring of blood pressure, often through an arterial line to avoid severe hypertension or hypotension. Peripheral pulses and oxygen saturation are important but not the priority before norepinephrine administration. Question 4. A patient in cardiogenic shock is receiving dobutamine. What is the primary mechanism of action of this drug in managing cardiogenic shock? A. Vasodilation to reduce afterload. B. Increased myocardial contractility and cardiac output. C. Decreased heart rate to reduce myocardial oxygen demand. D. Enhanced renal perfusion to reduce fluid retention. Answer: B. Increased myocardial contractility and cardiac output. Rationale: dobutamine primarily works by increasing myocardial contractility, which boosts cardiac output, making it useful in managing cardiogenic shock. It has minimal effects on heart rate and afterload, and it does not directly enhance renal perfusion. Question 5. A patient is in cardiogenic shock after a severe MI. The nurse notes decreased urine output, confusion, and cool extremities. What does this indicate about the patient's condition? A. The patient is improving. B. The patient is experiencing renal failure. C. The patient is in the early stages of recovery. D. The patient's perfusion is worsening. Answer: D. The patient's perfusion is worsening. Rationale: decreased urine output, confusion, and cool extremities are signs of inadequate perfusion, indicating that the cardiogenic shock is progressing and the organs are not receiving sufficient blood flow. Question 6. A patient in cardiogenic shock has a blood pressure of 70/40 millimeters of mercury. The healthcare provider orders an intra-aortic balloon pump, IABP. What is the primary goal of this therapy? A. To increase coronary artery perfusion. B. To decrease myocardial oxygen consumption. C. To reduce fluid overload. D. To decrease heart rate. Answer: A. To increase coronary artery perfusion. Rationale: the intra-aortic balloon pump increases coronary artery perfusion by inflating during diastole, helping improve blood flow to the heart. It also decreases afterload, reducing myocardial oxygen consumption, but fluid management is not its primary function. Question 7. The nurse is caring for a patient with cardiogenic shock who is being treated with a continuous infusion of milrinone. Which assessment finding would be of most concern to the nurse? A. Blood pressure of 90/50 millimeters of mercury. B. A heart rate of 110. C. A potassium level of 4.2 milliequivalent per liter. D. Presence of ventricular dysrhythmias. Answer: D. Presence of ventricular dysrhythmias. Rationale: milrinone can cause dysrhythmias as a side effect, particularly in patients with underlying heart conditions. Monitoring for these arrhythmias is crucial because they can worsen cardiogenic shock. Low blood pressure and an elevated heart rate are expected but should be closely monitored. Question 8. A patient in cardiogenic shock has been intubated and is mechanically ventilated. What is the nurse's priority intervention to assess oxygenation and ventilation? A. Monitoring continuous pulse oximetry. B. Checking for symmetrical chest expansion. C. Drawing arterial blood gases, ABGs. D. Auscultating breath sounds every hour. Answer: C. Drawing arterial blood gases, ABGs. Rationale: arterial blood gases provide the most accurate assessment of the patient's oxygenation, ventilation, and acid-base status in critical conditions like cardiogenic shock. Pulse oximetry and auscultation are helpful but less definitive. Question 9. The nurse is caring for a patient in cardiogenic shock who is not responding to vasopressors and inotropes. The healthcare team discusses the possibility of extracorporeal membrane oxygenation (ECMO). What is the primary purpose of ECMO in this scenario? A. To remove excess fluid from the body. B. To provide circulatory and respiratory support. C. To increase oxygen saturation. D. To stabilize blood pressure. Answer: B. To provide circulatory and respiratory support. Rationale: ECMO provides temporary mechanical support for both cardiac and respiratory systems when conventional therapies fail. It supports oxygenation and circulation, allowing the heart and lungs to rest and recover. Question 10. A patient is in cardiogenic shock and has developed pulmonary edema. The healthcare provider orders furosemide, Lasix. What is the nurse's priority assessment before administering this medication? A. Serum potassium level. B. Respiratory rate. C. Blood glucose level. D. Capillary refill. Answer: A. Serum potassium level. Rationale: furosemide is a potent diuretic that can cause hypokalemia, especially in patients with cardiogenic shock. Monitoring potassium levels before administration is critical to prevent life-threatening arrhythmias. Respiratory rate and blood glucose are important but secondary considerations in this context. Question 11. A patient with cardiogenic shock is receiving nitroprusside to decrease afterload. What is the primary side effect that the nurse should monitor for during this therapy? A. Cyanide toxicity. B. Reflex bradycardia. C. Increased cardiac output. D. Renal failure. Answer: A. Cyanide toxicity. Rationale: nitroprusside can lead to cyanide toxicity if used for an extended period or at high doses. Monitoring for symptoms such as confusion, headache, and metabolic acidosis is important. Reflex bradycardia is less common with nitroprusside, and while it decreases afterload, renal failure is not a direct side effect. Question 12. A patient presents with cardiogenic shock after an acute MI. The nurse notes that the patient's central venous pressure, CVP, is elevated. What does this finding indicate? A. Left ventricular failure. B. Right ventricular failure. C. Hypovolemia. D. Effective compensation. Answer: B. Right ventricular failure. Rationale: elevated CVP is a sign of right ventricular failure, often seen in cardiogenic shock when the heart cannot effectively pump blood through the pulmonary circulation. This results in fluid backup in the venous system. Left ventricular failure typically leads to pulmonary edema. Question 13. The nurse is preparing to assist with the insertion of a pulmonary artery catheter in a patient with cardiogenic shock. What is the primary purpose of this procedure? A. To monitor systemic vascular resistance. B. To evaluate left ventricular end diastolic pressure. C. To measure blood pressure continuously. D. To assess fluid balance. Answer: B. To evaluate left ventricular end diastolic pressure. Rationale: a pulmonary artery catheter is used to measure pressures within the heart, particularly the left ventricular end diastolic pressure, indirectly through the pulmonary capillary wedge pressure, which helps guide treatment in cardiogenic shock. It also provides information on cardiac output and fluid status. Question 14. A nurse is caring for a patient with cardiogenic shock who has just been transferred from the ICU. What is the most appropriate intervention to prevent complications from immobility in this patient? A. Administering prophylactic anticoagulants. B. Encouraging fluid intake. C. Providing passive range of motion exercises. D. Monitoring for deep vein thrombosis, DVT. Answer: C. Providing passive range of motion exercises. Rationale: passive range of motion exercises can help prevent complications from immobility, such as contractures and pressure injuries, without overly stressing the heart in cardiogenic shock. Prophylactic anticoagulants and DVT monitoring are essential, but physical movement is key to preventing musculoskeletal complications. Question 15. The healthcare provider orders a dobutamine infusion for a patient in cardiogenic shock. Which assessment finding would indicate that the dobutamine is effective? A. Decreased blood pressure. B. Increased urine output. C. Slowed heart rate. D. Elevated central venous pressure. Answer: B. Increased urine output. Rationale: increased urine output indicates improved renal perfusion and cardiac output, which suggests that the dobutamine infusion is effectively increasing myocardial contractility. Decreased blood pressure and elevated CVP would be concerning signs, while a slowed heart rate is not directly related to dobutamine's action. Question 16. A patient in cardiogenic shock has an order for mechanical ventilation. What is the nurse's priority action before initiating ventilation? A. Administering IV sedation. B. Instructing the patient on how to use the ventilator. C. Suctioning the patient's airway. D. Preparing for arterial blood gas (ABG) monitoring. Answer: A. Administering IV sedation. Rationale: IV sedation is essential to ensure patient comfort and minimize distress during mechanical ventilation. Once sedated, the patient can be more easily managed on the ventilator. Suctioning and ABG monitoring are important but occur after intubation and stabilization. Question 17. A patient develops cardiogenic shock after cardiac surgery. The nurse anticipates the healthcare provider will order which of the following diagnostic tests to evaluate myocardial function? A. Chest X-ray. B. 12-lead ECG. C. Echocardiogram. D. Cardiac catheterization. Answer: C. Echocardiogram. Rationale: An echocardiogram provides a direct assessment of myocardial function, including ejection fraction and wall motion abnormalities, which are critical in evaluating the severity of cardiogenic shock. A 12-lead ECG can show ischemia but does not assess contractility. Question 18. A nurse is monitoring a patient in cardiogenic shock who is on norepinephrine. Which of the following findings should prompt the nurse to immediately notify the healthcare provider? A. Urine output of 20 milliliters per hour. B. Mean arterial pressure of 65 millimeters of mercury. C. Heart rate of 95. D. Warm, flushed skin. Answer: A. Urine output of 20 milliliters per hour. Rationale: oliguria, urine output less than 30 milliliters per hour, indicates poor renal perfusion and worsening cardiogenic shock, requiring immediate intervention. A MAP of 65 millimeters of mercury is acceptable, and a heart rate of 95 is within a reasonable range. Warm, flushed skin is unusual in cardiogenic shock and could indicate a shift toward septic shock, but decreased urine output is more urgent. Question 19. A patient in cardiogenic shock has an arterial line in place. What is the most important nursing consideration when caring for this patient? A. Ensuring the arterial line is zeroed and calibrated. B. Checking for pulses distal to the insertion site. C. Keeping the patient in Trendelenburg position. D. Flushing the line every 4 hours. Answer: B. Checking for pulses distal to the insertion site. Rationale: ensuring adequate circulation to the limb where the arterial line is inserted is critical to prevent ischemia. Zeroing and calibration are important but not as critical as monitoring distal circulation. The Trendelenburg position is contraindicated in cardiogenic shock, and regular flushing is necessary but not a primary concern. Question 20. A patient presents with cardiogenic shock and lactic acidosis. The nurse anticipates which intervention to address the patient's acid-base imbalance. A. Intravenous sodium bicarbonate. B. Administration of a vasopressor. C. Initiation of mechanical ventilation. D. Fluid resuscitation with normal saline. Answer: A. Intravenous sodium bicarbonate. Rationale: in cases of severe lactic acidosis, IV sodium bicarbonate may be used to correct the acid-base imbalance. Vasopressors and mechanical ventilation may be necessary but are not directly related to correcting acidosis. Fluid resuscitation with normal saline is generally avoided in cardiogenic shock to prevent fluid overload. Question 21. A patient is diagnosed with cardiogenic shock secondary to an acute MI. Which lab value would be most concerning to the nurse in this scenario? A. Elevated troponin. B. Low hemoglobin. C. Decreased serum lactate. D. Increased blood urea nitrogen, BUN. Answer: A. Elevated troponin. Rationale: troponin is a specific marker of myocardial injury. Elevated levels indicate that the heart is suffering damage, worsening the cardiogenic shock. Low hemoglobin and increased BUN are important but are not specific indicators of myocardial injury in this scenario. Question 22. A patient with cardiogenic shock requires vasopressor therapy. Which of the following medications should the nurse anticipate administering? A. Epinephrine. B. Nitroglycerin. C. Lisinopril. D. Furosemide. Answer: A. Epinephrine. Rationale: epinephrine is a vasopressor that increases cardiac output by stimulating the heart and constricting blood vessels, making it useful in cardiogenic shock. Nitroglycerin is a vasodilator and would lower blood pressure, while lisinopril and furosemide are not indicated in the acute management of shock. Question 23. The nurse is caring for a patient in cardiogenic shock who has an order for mechanical circulatory support with an Impella device. What is the function of this device in managing cardiogenic shock? A. It augments ventricular contractility. B. It reduces pulmonary vascular resistance. C. It filters blood to remove toxins. D. It decreases heart rate. Answer: A. It augments ventricular contractility. Rationale: the Impella device is a mechanical pump that supports the heart by increasing cardiac output and unloading the left ventricle, thus improving perfusion in patients with cardiogenic shock. It does not reduce pulmonary resistance or filter blood. Question 24. A patient in cardiogenic shock has a Swan-Ganz catheter inserted. Which hemodynamic parameter is the most important for the nurse to monitor? A. Pulmonary artery pressure, PAP. B. Mean arterial pressure, MAP. C. Central venous pressure, CVP. D. Cardiac output. Answer: D. Cardiac output. Rationale: cardiac output is the most critical parameter to monitor in cardiogenic shock to assess how well the heart is pumping blood. PAP and CVP provide useful information, but cardiac output directly reflects the heart's ability to perfuse the organs. Question 25. A patient with cardiogenic shock is being treated with a nitroglycerin infusion. The nurse notes the patient's blood pressure has dropped to 85/50 millimeters of mercury. What is the nurse's priority action? A. Stop the nitroglycerin infusion immediately. B. Decrease the infusion rate and notify the healthcare provider. C. Administer a fluid bolus. D. Elevate the patient's legs. Answer: B. Decrease the infusion rate and notify the healthcare provider. Rationale: the nurse should decrease the nitroglycerin infusion rate, as it is likely contributing to the drop in blood pressure. The healthcare provider should be notified to reassess the treatment plan. Stopping the infusion abruptly may cause rebound hypertension, and a fluid bolus could worsen the patient's condition in cardiogenic shock.